Okay, so I've had a request to delve a little deeper into V codes, and for some reason, they are very intimidating to people, and I don't know why, but they really don't need to be. So don't be scared by them. Let's just break them down and see what we can come up with. Okay, so there are only 4 times that you're going to use V codes, 4 circumstances. Number one is when someone who's not sick goes to the doctor or encounters some type of health care services. So let's say you are going to the doctor for your annual physical. You're not sick, there's nothing wrong with you, but you're going to just get a checkup and make sure everything's good where it should be, looking at your cholesterol level, blah, 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 right? You take your kids for their annual physical. There's nothing wrong with them, but they go for their well baby checks or their well child checks. Maybe someone's an organ donor. There's nothing wrong with them, but they're having surgery, right? So we have to have some type of a code to put on their visit. That's going to be a V code. That they have encountered health services for some reason other than being actively sick or actively injured. Okay? The second time is going to be when you have a person who has a long-term injury or chronic illness that they've had for a long time that has required visit after visit after visit after visit for care. All right? That's called aftercare. Those types of things are going to be things like dialysis, right? Because you have chronic kidney disease, you're going in for dialysis 3 times a week, 4 times a week for 5-6 hours a day until you have that resolved, right? When the only resolution is going to be a kidney transplant. So you're there for a long time. Chemotherapy is something that is visit after visit after visit for a certain period of time, right? That is, that's a code that's going to be a V code, right? That's going to be a V code. So, for instance, with the chemotherapy, it's going to be encounter for chemotherapy, all right? The next one is when circumstances might influence a person's health status, but they're not a current issue. So, for instance, the patient who has the CABG or the coronary artery bypass graft 2 years ago. Issues resolved. They don't have a problem. They're pretty healthy, but they go to the doctor for some reason. Maybe they've got diabetes, or they're in the hospital because they've got diabetes out of control. That previous CABG is not significant in that they're going to have to treat the person for having it currently. So they're not going to have to give them do anything special for them regarding that particular CABG procedure. However, it may change the way they treat the person's diabetes. So a history of having had that CABG might change the way they treat the person. It might change their treatment plan. It may influence what the doctor decides to do. Okay? The last time that we're going to use a V code is for newborns to indicate what their birth status is. Were they a live birth? Were they a stillborn birth? Were they a single infant? Were they multiples? Were they twins? What were they? To tell us, because there's nothing wrong with them, right? This is, again, an encounter for healthcare when there's nothing wrong. They are healthy, right? But we have to put something on their chart because they become an admitted patient the minute that they're born. So unless there's something wrong with that infant, in which case the diagnosis code of whatever that disease condition or disease process is would become their principal diagnosis. They are healthy, there's nothing wrong with them, you're going to use a V code. Okay? So now let's talk about, so now we know the 4 situations we'll use a V code. When there's an encounter for health status, when there's an encounter for health care, when there's nothing wrong with the patient, going to the doctor for your annual physical, when the patient has long-term condition or injury where they have to go in for chronic aftercare, chemotherapy, dialysis, radiation, or when the circumstances of a person's health care status is going to influence maybe the choices the doctors make to treat them. The cabbage, history of a kidney transplant, that could change the way they treat another disease process that is current. So it's significant and needs to be coded. Or newborn status, right? Okay, so now we know those. Let's talk about the categories of V codes. And we actually have quite a few of those. We have 15 categories of V codes. So we're just going to kind of go through those, not in a great detail, but we're going to talk about them a little bit, okay? So the first category that we have is contact or exposure. And this is when someone has had contact with something that could cause them harm, but they're not showing any signs or symptoms yet. So for instance, we see it all the time, asbestos. If you have contact with asbestos, but you don't have any signs or symptoms, they're probably going to test you. They're going to do chest x-rays. They're going to do all kinds of things because they know you've come in contact with that asbestos. They're going to check you to see if there's anything going on. Potentially hazardous body fluids. So let's say you work in healthcare as a nurse. I worked my way through school in a laboratory and a morgue. So here I am drawing blood. And I was stuck with a dirty needle on several occasions. Well, I had to go through a testing process. When I did that, they had to be able to put something on my chart for a code to justify the testing. They needed to use a V code because I didn't show any signs or symptoms. But I had been exposed to potentially hazardous bodily fluids. We didn't know, right? Okay. Those types of things. Exposure to lead. Children and lead, that's a big thing, isn't it? We're supposed to be lead-free paint. Well, some of these old houses back from the 60s and 70s and before, they have not been repainted in some areas. And what do babies like to do? They like to chew on things, windowsills, right, etc. So that's an exposure to lead. Okay, so that's going to be a V code. It's a contact or an exposure to something that could be harmful in the future, but right now you're not having any issues. Okay, then we have inoculations and vaccinations. Those are pretty self-explanatory. You're healthy, there's nothing wrong with you, but they're going to give you those vaccinations to help build your immunity, right? So you don't catch something. So those are going to be V codes because you're healthy, there's nothing wrong. We're just having an encounter with healthcare to get a shot. Okay? Status codes. Number 3 are status codes. So what that means is that a status code could be a couple of different things. It could be 3 different things. It could be number 1, that a patient is a carrier of a disease. So perhaps they were exposed to tuberculosis. But they never showed any signs or symptoms. They never had any issues. They never had any problems. However, they are still considered a carrier of that disease. Perhaps they were exposed to hepatitis C or hepatitis B. Never showed any signs or symptoms. However, never became ill. However, they are still a carrier of that disease. Okay? That's going to be a V code because that could be significant, could it not? That someone is a carrier of hepatitis B or C. That could be pretty significant, okay? Has the residual effect of a past disease or condition. So that's going to be someone that has some type of perhaps they have a residual effect from having a stroke. Okay? you're probably going to have a V code on there. They have a leftover issue with having a stroke. You're going to have a V code. Okay. What about the third, which is there's another factor that's influencing their health status. So perhaps they were a transplant patient. It's probably going to be significant to know somebody's had a lung transplant. For any other treatment in the hospital, that's going to more than likely change a lot, right? That's going to probably change the anesthesia that's given if they have to have surgery, the way they're treated with anesthesia. It's going to influence a lot of different things when it comes to decisions about health care with current issues. All right? So, the one thing you do have to remember about status codes and things like transplants or other surgical procedures, if someone's having a complication of that procedure, then it's coded as a complication with a 99 code. It would not be coded to a transplant status, because its transplant status is they've had the heart transplant or the lung transplant or kidney transplant, but they're not having any issues with it at all. Complications is they're having complications of that. So it's a different situation, right? Because it's a current disease process. Okay? Those other types of things that are going to fall in there are things like maybe someone who's waiting for a lung transplant. Sometimes we have to admit them to the hospital. We want to have that in there. We want to know that we're waiting on a lung transplant, right? Physical restraints. We had talked about that. Someone had asked about physical restraints. There's something in there. I did a Snagit concerning physical restraints and why we do it. Body mass index. Retained foreign body. Okay? That's a big one. That's going to happen. Maybe we left a sponge in. Maybe there's something going on there that's stuck that shouldn't be there. Okay? Dependence on machines, other dependence on machines. Are you dependent upon some type of a medical device? Do you have a prosthesis? Have you had an amputation of some sort? Those are all things that are going to possibly influence the way we treat you when you're in the hospital, or when you're when you come in contact with healthcare. History of codes. These are pretty self-explanatory. There are personal history and family history. You're only going to code these when it has an influence or could be an issue on the way we're treating you. So, for example, family history code. If you are a 20-year-old woman and your mother, your grandmother, 3 aunts all died of breast cancer, they're going to probably start doing mammograms on you fairly early. All right? But we do know that typically mammograms are done after the age of 40 every year. So we're collecting that data. We need to be able to know you don't have any problems. You haven't found anything in any breast, but we're going to do a mammogram on you to make sure that we don't miss something. Okay? You're going to need to have a family history code on there to explain, okay, we're doing this mammogram. Why are we doing the mammogram? Because you got to justify that, right? Okay? In addition to that, you might have what's called a screening code, which is our 5th category. And a screening code is where we do testing on a regular basis to ensure that there are no changes in your health. So for instance, let's go back to that breast cancer example. There are actually going to be 2 V codes on that particular patient's record. The first one is going to be a screening code. It will be a screening mammogram. Then we have to tell them, okay, this is what we're doing. This is why we're doing it. So we're doing a screening mammogram, V code. And the reason we're doing it is there's a family history of breast cancer. Additional V code. All right. You'll also use these for things like colonoscopies. After the age of 50, you're supposed to have a colonoscopy every so many years. PSA tests for men over a certain age. It just depends, okay, on what the accepted standard of care is. So you just have to make sure if you're within that accepted standard of care, you probably don't need to have the additional YV code as far as why are we doing this. But if you're outside of that normal accepted standard of care, you're probably going to need to have another V code of why we're doing a screening so early, and that's probably going to be a history or family history V code. Okay? The sixth category we have is observation. So we have 3 observation code categories. Okay? They're pretty easy. There's the observation code itself, which is observation and evaluation for suspected condition not found, which is V71. Then we have V29 and V89. Those are both related to newborns. Okay? Both of them are related to newborns. You're going to use these, so for instance, someone's in a car accident and they want to keep them in the hospital because they just want to make sure that they didn't miss anything. They appear to be fine, but they just want to keep them because they want to keep them overnight because, as we all know, you fall down, when does it hurt worse? The next day, right? Or later on. So they want to check and make sure, and sometimes things like head injuries and broken bones, etc., rear their ugly heads hours after it happens, and the person can seem like they're absolutely fine. All right, so that would be a V code, a V71 code. All right. Aftercare. So aftercare is, these are things like those codes that I talked about a little bit earlier. Encounter for chemotherapy, encounter for radiation. Maybe you have a patient who's had a radical mastectomy. They're doing breast reconstruction on that patient. Any type of surgery or procedure or any type of care that's given to a patient after the treatment, the initial treatment for the injury or disease process has been performed. So what do we typically do when we see someone who has cancer? We do the surgery to remove the cancer, then we have them come in after that for chemotherapy and or radiation, right? So that is considered aftercare. We've performed the initial treatment, which is the surgical procedure for removal or excision of the tumor or whatever. And then we do the aftercare, which is the chemotherapy or the radiation. Those are going to be V codes. All right? They're all V codes. Okay? Follow-up codes are just that. They are codes to indicate that we're performing a follow-up for something we've already done. Birth, childbirth, postpartum care and evaluation, V24. So the patient's coming in, she had a baby, she's coming in just for her checkup. You have surgery, what does the doctor say to you? I want to see you in 3 weeks. Want to see you next week. You go in, you see the doctor, that's going to be a follow-up code. All right? Category 9 is donor. So these are for people who are living donors. It is important to remember the word living. These are not cadaver donors. Living donors. So people that donate partial lobe of their liver, people who donate kidneys, people who donate bone marrow. Those people will fall under the donor category. Don't ever, ever, ever code a donor when you have someone who is a cadaver donor. also, the donor code does not go on the record of the person who is receiving the donated organ, because they have an illness. They're not a donor, they're a recipient. Okay? That donor V code is for the person that's coming in to donate, because they're perfectly healthy, but they have to donate that kidney. So we have to have something to put on for them, right? All right. Then we have counseling codes. And those are just what they sound like. They're codes that we put on for when we're doing any type of counseling with a patient or their family. Genetic counseling, HIV counseling, dietary counseling. You're newly diabetic. You need to be counseled on how you should be eating and how many carbs and when should you take your medication and what should your sugar be and what to do when it's too high or too low, right? Okay. Our 11th category is obstetrics and related conditions. All right. These are things like our normal pregnancy codes. So let's say these are used a lot throughout the outpatient process of being pregnant. So when you're pregnant, you have to go in quite often for visits. You have to go in and have blood drawn. You have to have checkups. You have to have ultrasounds, and you have to have, I mean, it just is, it's endless. So and it increases the farther along in your pregnancy. So they need to have some type of code to put on that patient's chart to say, hey, you're healthy, but you have to come in to be checked, or this is the reason. V codes is where it's at. All right. So you have V code 22, which is normal pregnancy. Then you have V code 23, which is supervision of a high-risk pregnancy. You will not have these two codes on the same chart. You can't have a normal pregnancy and a high-risk pregnancy at the same time. Okay? You'll have your postpartum care. You'll have your outcome of delivery codes, which are, you know, did you have a single live born? What type of infant did you have a stillborn? What kind of infant did you have? So that's going to fall into your obstetrics and related conditions, okay? Then, of course, we have our newborn codes, all right? V20 is health supervision of infant or child. That's going to be like your well child checks, okay? And then we have our live born infant, which is the status, were they, you know, were they single, were they multiple, were they twins, what were they, okay? And then we're going to have another one that's called observation and evaluation for newborns for suspected condition not found, V29. That is, we think there's something wrong with the kid, we're going to keep them, but there's nothing there. It is different from the observation codes that we talked about earlier. These are used only for infants, and you do not, for newborns, and you do not use the observation codes from earlier on newborn charts. The flip side of that is the key word is newborn. Once you are born and you leave the hospital, you are no longer a newborn medically. You are now an infant. If you were to come back, you would become an infant. Therefore, you would then use the observation codes we talked about earlier. These V29 codes are only used for newborns that we're keeping for observation. All right? Then we have routine and administrative exams. Again, injections, just medical exams. These are going to be things like your annual exams that you have. Special investigations and examinations is V72. Okay, so everybody wants to know, well, what does that mean? Well, let's talk about some special instances where you may go see the doctor that you normally would not have gone otherwise. So for instance, your child is, my nephew goes to Mackinac Island every every summer, he is in the Boy Scouts, and he does the governor's honor troop, honor guard every summer for a week. So in order for him to go, he has to have a special physical. He plays football. He has to have a special physical before he can participate. Those are going to be special investigations and examinations. Someone is going to prison. If you go to prison, they're going to do a physical exam on you. And it's going to be pretty thorough because they want to know what's going into what's being injected into there and inserted into their prison population, correct? That's a special investigation or examination. Occupational health, you go before you start a job or you're offered a job. Those are, again, special investigations or examinations, okay? Number 14 in our list are miscellaneous codes, all right? These are going to be things like prophylactic removals of organs. So let's talk Angelina Jolie, all right? So far she's had a double mastectomy, and she's had an oophorectomy, bilateral oophorectomy, and that was due to the fact that her mother had died of ovarian cancer, and she did test positive for genetics, the gene that says that she is more likely to get cancer than someone who does not have that gene marker. Therefore, she opted to have the prophylactic removal because if the organ's not there, you can't get the cancer. That would fall into this particular category of V codes, all right? It's also going to be things like palliative care, encounters for administrative purposes. And you will see that some of these things are going to fall into more than one category. It's going to depend, these V codes, it's going to depend on the context in which you're presented, the situation, all right? But it's very possible to have a V code fall into more than one of these categories, okay? The very last category we have are non-specific V codes, and that's just what it sounds like. They're just ones that are just not super specific. They are possibly redundant. There might be other codes in that particular classification that would be better. If you come up with a non-specific code, it's just like if you find a 0.8 or a 0.9, another diagnosis code ending in 8 or 9, you probably should double check and make sure you're not missing a more specific code that could possibly work. All right. There are some codes that can only be used as principal diagnoses, V codes. That listing is on in Chapter 8 on page 197 in your textbook by Lovason. All right, so take a look at that. You don't have to memorize those, but do know that, you know, these are the types of things that can only be used for principal diagnoses. You can't put these as secondary diagnoses. All right. I think that's about it for V codes. I hope that has helped. If not, let me know.